Welcome to the Winners in Business podcast, where we celebrate and learn from those who have turned their dreams into success stories. I'm your host for this episode, Jeff Davis, where each week we sit down with business leaders, entrepreneurs, innovators who have mastered the art of winning in today's competitive world. And after all, this is Winners in Business, where winning is more than just a goal, it's a mindset. Huge thank to our sponsor for supporting this podcast. First, there's Beachfront Custom Development, who are leaders in software and mobile app development. For over 23 years, they've worked with big names like Coca-Cola, Warner Brothers, NFL, as well as building software and mobile solutions for growth stage companies in industries like healthcare, financial services, education, and gaming. For top quality development at any stage, head over to beachfrontcustomdevelopment.com. And let's not forget Impact Business Marketing. If you are fed up with the agencies that overpromise and underdeliver, these guys are the real deal. No contracts, just results. From websites to SEO, online marketing, social media, they've got you covered. Visit impactbusinessmarketing.com and you will not regret it. In every episode, we dive deep into the challenges that many business owners face, whether it's scaling a company, staying ahead in this digital age, or building a strong team. And we uncover the strategies, the tools that make overcoming these obstacles possible. And our guests share their battle-tested insights so you can learn how to win in your business no matter the odds. And before we dive in, make sure to follow Winners in Business on your favorite podcast platform and visit us at www.winnersinbusiness.com for more resources, exclusive content, updates, and let's get into it. Today, I have with me Dr. John Jacobsen, who owns Click Family Healthcare. And thank you so much for being here. Excited to get into this conversation with you. You've obviously taken your own path for your practice and a more innovative approach than the same standard. What do you attribute your growth to?
Well, I think the first thing is I was a banker for 10 years before I went back to medical school. So I think a lot of it is just thinking outside the box and not staying with the status quo. So when it comes to where did our growth come from, or why do I think we've had the growth, simply because we're offering a product that people, need, people can afford, a product that's replicable, and a product that's available when it's necessary. Unfortunately, our current healthcare system does not offer those criteria. One, it's not easy to use. Two, it's hard to get in to see your doctor. Three, it's expensive. It's not affordable. So I think it's just the whole program or the whole model itself lends itself to providing better healthcare.
Yeah. I'm sure on your path you've learned a lot along the way, and based off all those different past experiences, if you were coming into a brand new business, maybe a totally different business, based off your lessons that you've learned, what do you think would be some of the first things that you think you would look into doing to start growing that business?
Well, I think when you look at any business, the top two expenditures typically are salaries and benefits. So when you look at how can I grow my business, you have to, I think, start with salaries and benefits. To get good people, you have to provide good benefits. You have to be able to be competitive in the market with your salaries. Direct primary care allows people to do that. There are insurance companies out there that are selling a product nobody can afford to buy. The deductibles are high, premiums are high, so employees don't utilize those. So they show up sick, or they call in sick. So you're missing the ability to do whatever you do, whether you buy wood or whether you sell widgets, whether you make widgets, whatever. If you don't have employees there to do that, you're losing money. So direct primary care allows allows companies to be able to offer a benefit to their employees that's actually accessible. The problem with medicine in too many situations is that you can provide me with a health insurance policy, but it's got a $5,000 deductible, and I can't afford the $200 to walk into the doctor's office. But if I'm an entrepreneur and I match a self-insured plan, or I match a Christian share plan or one of the share plans with direct primary care, now I'm offering my employees a benefit they can utilize, a benefit that's affordable for them, and it's kind of the best of both worlds.
Yeah, for sure. What do you feel that most small business owners do wrong?
I think a lot of times, one, going in underfunded,
Hmm.
is,
Yeah.
and that's coming more from being the ex-banker, that
Hmm.
we start things out spring, we don't have a backup plan.
People
Um,
are too,
I will
entrepreneurs
tell
are
you
too,
for
yeah. Uh, I was gonna say entrepreneurs are
in
too optimistic
my
sometimes.
at times, yeah. I mean, um, and you have to be. I mean, you have to be driven in order to be successful as an entrepreneur. You
Right.
have to believe in the product that you're selling or that you're promoting. But a lot of times you also have to have a backup plan. So I'm not generating the cash flow or the revenue to cover what I need to be covering or cover my expenses. So what can I do in the backside? Do I start this business as part time? Do I jump right in full time? Do I have what kind of a network have I built? Um, so for me personally, I didn't take any money out of my business for about 18 months. And I moonlighted, which means I covered small town ERs one weekend a month to pay my bills, my family bills, until we were able to start generating enough revenue that I could start pulling money out of my business.
Hmm.
So
Yeah, I
it's
love
having that
overlap
backup plan.
thing.
Yeah, you have to think. You plan for the worst and hope for the best. You
Hmm.
know, is kind of my thought process.
Yeah. You have a business background before your medical background. Were there any books that were really influential to you?
Um, 7 Daily Habits. I think is a good book. Crucial Conversations, I think, was a good book. So those aren't really business-backed books, but they're more how to deal with public, how to be successful as an entrepreneur. Um,
Mm, yeah.
I was when I was in banking, I was in compliance. So a lot of the stuff I did was sitting and reading the rules and regulations, which is not typical reading that most people want to just pick up and go with because it's pretty boring.
No, probably not. Well, if yeah, it's probably not fun Saturday night action, but if you could go back in time to when you were first starting out this business, is there anything that you would say to slightly younger you?
The biggest thing I would tell myself is don't be afraid of failure. Um, I'm a very analytical person, so I look at all the pluses, all the minuses, and uh, was when I was younger was very risk averse, and not that I'm not still risk averse, but risk averse in the idea that there are better opportunities being your own boss. There are better opportunities going away from the mainstream. There are better opportunities um, not listening sometimes to your parents saying you need to go to college, you need to get a 4 year degree, you need to do this, you need to do that. So for me personally, because I'm a rule oriented person. I kind of live by the societal norms of you know get up, go to work, do a good job. I'm a person that I'm of the generation where we live to work, we don't work to live, kind of a thing. So for
Mm,
me personally, if I could go back, it would be be less risk averse, take some chances. You have your whole lifetime ahead of you. If you lose some money, or if you have a setback, you fail, you've still got the rest of your life to jump in and do what you want to do. I started my business at 57. Um, So
Ah,
it was, and I never really had any fear it would fail, but you don't have that opportunity to really bounce back if it does fail.
that's awesome though to start it at 57. Because we've all heard about Ray Kroc, getting involved in McDonald's at 52 and that story, but that was a long time ago, and now you think, uh, I mean, that's a perfect example. My brother had a friend who he started a business at around 80 and then exited at about 84 for like 20 million. And so that's awesome, right? And I'm sure his heirs were like, yes. But
Thank
oh
you.
yeah,
My
oh
heirs
okay,
will be
bonus,
that.
yeah, a bonus 20 mil at the buzzer. Okay. Um, what what technological changes do you see on the horizon for your kind of business, if any? Um, Anything that you see in the next few years, maybe AI related or otherwise?
I think AI is probably going to be the biggest game changer in a sense. The problem with AI is you still don't have that personal connection. And that's one of the issues or one of the problems we have in today's healthcare system is we don't have that personal touch. We're a plus $1 trillion a year industry that has basically zero customer service. And AI is going to add to that. Well, AI is good. It can document my notes. It can maybe give me, help me expand my differential diagnosis or help me with the treatment plan. But it's still that personal touch of being able to sit and talk to you and touch you and listen to you and get my stethoscope out and examine you. That's what people really strive for and miss in our today's system. You look at the healthcare industry. How many big startups have failed because they wanted to do things remotely? They want to do telemedicine and just only telemedicine. They wanted to utilize technology sometimes in a way that wasn't really feasible. But
Right.
people, when they need to go to the doctor, they want the human touch. And so I think we'll see AI supplementing what we do, but I don't ever see AI taking over what we do. I
Right.
think the biggest fear I have, or the biggest thing we're seeing, is um, the influx of mid levels. Whether it's a nurse practitioner or PA that want to practice independently. They're not trained like a physician. They don't have the hours of education like a physician, but they
Mm,
want to act like a physician. And I
wow.
think we're degrading our health care, our population's health because of that. I think they're a valuable part of the team. Don't get me wrong. I mean, I would love to have a nurse practitioner and PAs as part of my team, but to be out there practicing independently, that's kind of where I have issues. And we
A
really
little
see
sketchy.
hospital systems forcing that issue because they can hire a nurse practitioner who can practice independently in most states for half of what they can hire a physician for. But on the flip side, how much extra money are we spending? How much are our patients suffering in the ER with additional testing? And suffering can be both monetarily, but it can also be physically and mentally. And hospital systems, which look for the bottom line of what's the ROI for our investors, a lot of times don't look at what it is best for their customer, and they sure don't look at what is best for their physicians. So, I think technology-wise, AI is going to be the biggest thing. We always continue to expand the surgical realm of things. I'm a little concerned about some of the technology when it comes to treating cancers, and right now, Ozempic is a big thing. Everybody wants the shot. They want a quick way to lose weight. What are the long-term effects of those treatments? So over time, everything changes. It's just a matter of how quickly you can adapt. But when it comes to primary care, which is what I do, I'm a family physician, or if you're a gynecologist or if you're an internist, technology really doesn't benefit us a lot. The bigger technology we're seeing is more in the surgical realm of things. Um, so kind of a long-winded answer to your question, but I think
No,
AI
it's
is probably going to
interesting.
be the biggest thing to help supplement.
And
But I don't
as
think
you
it'll ever be able to over.
Yeah, and as you look out, in the future, what are some of the things that get you excited about your business, and what are some of the things that you're doing to reach that, future that you're envisioning?
I think the biggest thing that excites me is the fact that with direct primary care, I can actually be a doctor. I'm not a box checker. I
Mm.
can focus on my patient, listen to my patient. Every clinic, every hospital has what's called electronic medical record, where you record the office visit, you record the hospital visit, you record the lab work, you record your orders. But those simply were built for billing. They were not ever built or thought about, well, how does that process interfere with how I interact with my patients? Um, so I think we'll see some technology coming forward that's much more interactive, that doesn't interfere with your and my relationship as far as me taking care of you,
It augments
and
it.
will log things more chronologically. Yeah, will be more intuitive to what we're doing. Um, and that's where I think AI kind of comes in, that it can sit and record if you have proper permission. It can record our conversation, and so I don't have to go back and dictate it all. I don't have to, it's putting everything there for me, and then I can refine it from
Mm.
there. Um,
Yeah.
but I think that's the biggest. My biggest thing is, from a primary care perspective, it all has to supplement face to face and relationship building. And that's where electronic medical records interfere with our relationship building, because I spend so much time looking at my computer that I lose focus on you as my patient or my customer. And so refocusing back to you as, one of the things I always argue with hospital administrators and insurance people and even my peers is, who's the boss? If you come in to see me in my clinic, who's the boss? Who's paying the bill? So in direct primary care, you're paying the bill. You're taking money out of your pocket and you're paying me directly because it's a monthly membership. But if you have Blue Cross Blue Shield, or you have Aetna, or you have Cigna, they're the one paying the bill. They're dictating what we can do, how we can treat you, and what kind of care you're going to get. So is that really what we want moving forward? And
Right.
I personally, that's why I got out of the insurance world, or what we call the system, and went into direct primary care, because I
Mm.
wanted to work for the person who was paying me. I wanted to have that relationship so that you and I could make the decision. We didn't have a third party telling us, well, no, you can't order that test because
You mean
it's
without
cost
a
this much money.
humongous, you mean without having a humongous corporate conglomerate looking for profit margins in the middle? Um,
Exactly.
what,
So,
uh,
it's a sad thing to say, but just recently, the murder of the
oh
UHC
yeah,
executive in New York City.
yeah.
I think there'll be more to come from that. Whether it was somebody's family, this guy's family member didn't get treated, somebody died, but there are so many roadblocks when you try to use health insurance. One of the biggest roadblocks is cost. And I'll give you an example. If you use your health insurance in my town, which has two hospital systems, town of about 30,000, you need an MRI of your knee. It's going to cost about $3,000 is what the insurance company is going to get billed. Okay? But if you pay for it up front, it will cost you $485. Now, what's the disconnect between $3,000 and $485? That's all the middleman. That's the profit margins. Now, I can tell you those hospital systems aren't losing money at $485, but where's the rest of it? What
Incredible.
composes, or what comprises that, the extra $2,500?
Yeah, incredible. Um, what advice would you give to other business owners or startups or even aspiring entrepreneurs who are looking to move to the next level?
I think one is you have to have the focus. You have to believe what you're doing is going to benefit somebody. Again, it kind of goes back to what I learned within banking is one, you have to have a product that people need. You have to have a product people can afford. You have to have a product that's easily attainable, and you have a product that's beneficial or that provides value. And that's really what I've tried to focus on and what I educate my nurses on is less, we have to provide value because you're taking money out of your pocket paying us. So it doesn't
Right.
matter what business you're doing, you really have to have that, I think those four things that you're offering to people. The greatest one being value, um,
Yeah.
perceived
And,
value a lot of times, but
right.
is
Oh,
it
for
affordable
sure.
that they get the value?
And I would, yeah, I would say that perceived value, when it makes that perceived value level all the way up to a must have, it's not a would be nice. When it's a must have, that's like the holy grail. And
Correct. Yeah, I would agree with
that'll
that.
reduce attrition and churn, and that'll lead to referrals. That must have. Any parting words of advice for other business owners who might be watching this who are looking to grow?
Well, I think again, you go back and look at your top two lines of expense. And, a lot of times people look at benefits and say, well, there's nothing I can do. I have to provide health insurance. I have to do this. Uh, you know, get with your insurance broker and look at what other options are out there. Don't be afraid as a business owner to look at maybe a share plan or self-insured plan tied with direct primary care. Um, because then you can offer the best of both worlds and save yourself, 25 to 40% on your premiums. Well, 25 to 40%, that allows you to do a lot of expansion or a lot of growth in other areas to expand your business. So I think you have to look at your top two, salaries there. To me, there's really nothing you can do there. You have to be competitive, but on the benefit side, there are a lot of opportunities. I think that maybe we didn't have 5 years ago, 10 years ago, that are
Mm.
available now.
Yeah, and when people
Like anything, you
are
got to think outside the box.
yeah, and when people are looking at different opportunities of jobs to work at, sometimes some of those things that are just different, not, it's more of a lifestyle benefit really from working with a company that has something like your office that's a part of working there, right?
Hmm. Well, and my focus is I really like businesses 30 employees or less. That's kind of what I go after. I mean, we have employees that have 400 or 500 employees in our town. They don't really fit what I have to offer. So my focus or my offer really is for those companies with 30 or less employees. But I've had a couple companies that they've seen their bottom line or their benefits drop 40%. They one thing they had to do is they had to find a different insurance broker because the insurance broker was so focused on themselves and what their premium or what their pay was going to be that they didn't think about outside of the box. So, for instance, go with a self-insured plan. As an insurance agent, I'm probably going to lose 15-20% of my revenue, my commission by doing that because the premiums are going to be lower. But if I go to the CFO and say, look, here's an offer, you can do this, self-insured, tie it with direct primary care, you're going to save yourself 40% on premiums. Would you be willing to give me 10% of that? Because it's going to cost me money to switch you to this because I'm going to lose revenue in my commission. And what CFO is going to say, oh, no, no, we're not going to do that.
Hmm.
So you
Wow.
have to find a broker that's thinking outside the box as well. Because we
And
all,
how do you do
everything in
that?
life is follow the money. Pardon me?
And how do you do that? How does a business owner find
How do
that?
you find a different broker?
Yeah.
Um, there are more and more brokers are looking. getting out of that. Insurance right now is a tough market to sell, and so there are more and more brokers anyway in Nebraska that are looking. There are different organizations that are really promoting. David Contero is a guy that does a lot with training brokers on getting out of the traditional commission base and looking at alternative, especially in the healthcare market. So
Cool.
again, you've got to go looking for it. Nothing really ever falls in your lap. Very few things that are going to save you money fall in your lap. You got to go looking for them, and you got to put a little effort in.
Yeah,
But
that might be one of the biggest takeaways from this conversation is to not just get complacent and not be lazy, but actually go looking for some of these different outside of the box opportunities that could benefit your team, but also could provide an immediate ROI as well. Thank you so much. That was
Well, and I
awesome.
think a lot of times, the more successful we get, the more complacent we get. Because money's coming in and things are risk rolling. So I don't really think about what do I need to look at 3 years from now or 5 years from now, and then all of a sudden we're behind the eight ball because we didn't go outside and we didn't keep thinking, we didn't keep forward looking. So that's another thing that as an entrepreneur you can't get complacent. You've got to think 3 years, 5 years down the road. Where's this industry going? Whether it's building a widget, selling a widget, or providing healthcare. People think that medicine is a sacred product. Medicine is no different than the grocery store. I'm selling a product, and if you tell a physician that they're a salesman, it's like, no, I'm no way, I'm not a salesman. People are paying for my knowledge. They're buying my knowledge, so that's what I'm selling.
Right.
And so once you think about whatever your product is in that realm of what you're selling and what value you're adding, you have to keep on the forefront of things. And, how does AI affect my manufacturing business? How does AI affect my sales business? So there's all those things that as an entrepreneur, you've got to have rolling through the back of your head. And, I had a guy tell me one time, it was easy when I worked 8 to 5 because I had a 40-hour work week. Then I decided I wanted to be an entrepreneur. Now I'm working 60 hours a week or 70 hours a week.
Oh, yeah.
But it doesn't seem like it's 60 or 70 hours a week because I'm doing what I love to do. And
Most
that's,
of the time, right.
I definitely.
Yeah. Yeah. An entrepreneur friend of
Well,
mine said, Jeff, it's going great. I'm only working half days from 7 to 7. So,
yeah, 7 days a week.
yeah. But yeah. But it's worth it, right? When you're fighting like hell for a dream, then it's worth it. And if it's not, then something.
Well, and that's the big thing. Well, and I will ask my customers when they come in, how's things going, and facetiously the automatic response is, well, I'm living the dream. And my question I fire back is, are you living your dream? Because if you're not living your dream, you need to make a change. And that's, kind of going back to, when you asked me what would I tell my younger self?
Yeah.
Go for your dream. Don't just go for a job. Go for what you're passionate about. And, I was a banker for 10 years, and it took me about 10 years to become a doctor. I was in private practice for 10 years, and I was recruited to be the chief medical officer of a new startup company. And I realized after about 3.5 years that my passion was taking care of people. My passion wasn't babysitting other doctors. So then I resigned from that, and I opened my direct primary. So live your dream, do whatever you can to get to that dream, because all of our dreams are different. Some people just dream about getting up and go to work 8 to 5.
Right.
But if you have that spirit, go for it.
Awesome. I think that's a perfect sentiment to end it on. Thank you so much, Dr. Jacobsen. That was great. Thanks for listening today as we uncovered the hidden potential of just going after that dream and not being afraid of failing. Special thanks to our guest, Dr. John Jacobsen. Be sure to join us again next time as we have open and candid discussions with winners in business. Bye for now.